do talk a lot of nonsense, right? And convince people to do this and that.
Yeah.
So that would make sense. But what would be the most stark contrast of you moving from one profession to another? The man we'll be speaking to, Dr. Mahendraa, is a man who has done exactly that. It's mind-blowing. You will not see it coming, but stick around because we're about to delve into a conversation along the lines of brain and spine surgery, health, all you need to know. And he is well known in the medical world, and you won't believe which other part of the world he is known in terms of what he used to do. We'll come into that conversation just a bit. We do want to take a look of traffic because according to social media, X, and obviously our WhatsApp 0701-984-984, we have quite a bit to let you know.
What do partners of the Gates Foundation do when facing the world's toughest challenges? They keep going. From discovering a plastic drape that helps detect excessive postpartum bleeding faster, to developing better bed nets to kill malaria-carrying mosquitoes, to researching an RSV vaccine that could save hundreds of thousands of children. For every problem, there are people who prove that progress is possible. The Gates Foundation, partners of human potential. Learn more at gatesfoundation.org/keep going.
70 record closing highs.
Markets move fast. Don't get left behind. The Financial Forecast with Phalaris Wambui brings you insights from global to African economies.
When the stock market is booming, we're made to believe the economy is booming.
Tuesday, 6:30 p.m. only on 98.4 Capital FM.
Kwa hizi mitasi ufanya biz, lies the real heartbeat of Kenya. Us, the people. Si ndio wala sojituma, ndio to turn passion into progress. From small beginnings to thriving businesses, siwamka mapema ndio tujenge future. Na tukichoose partner kona internet fiti na solutions poa za mawasiliano. The sky is the limit. Power your progress with Safaricom Business. Dial *485# or visit business.safaricom.co.ke today.
Capital Traffic and Travel.
A big shout out going out to Jockey Dongo, who's stuck on Magadi Road. Girl, I feel you. 16-minute delays. Let us know what's going on. Could be an accident or just people. You know they need to expand that road because it's a road that feeds into... I don't know what's wrong with you. It's like, you know that road that feeds you from Galleria going in towards Rongai?
Yeah.
That road is so it's for the amount of human traffic that goes through that road. They need to expand it.
Yeah,
just the same way they need to expand Kiambu Road, which has been seeing significant delays on traffic. But yeah, the C58 Magadi Road delays of 16 minutes, Outer Ring Road delays of 11 minutes, and North Airport Road you're looking at delays of 12 minutes.
Other roads like Ngong Road, 13 minutes. It's crazy. And the usual law Kabete also up in arms, 7-minute delays. You see any incident or accident, we already heard a few accidents here and there and why they cause traffic along some of those respective routes. If you see anything else we haven't mentioned, please let us know. We're about to delve into the conversation with Dr. Mahendraa, and it will be one to look out for. Before we get there, it's Jackson 5, Never Say Goodbye.
Capital Traffic and Travel.
Let's have one final test. Throw the switches. Good morning.
Your morning dose of news, fun.
I have music in my life with Sam.
Allow me to demonstrate.
And all the hits with Chico and Phalaris. Right here on 98.4 Capital FM.
Never can say goodbye.
Well, the Jackson 5 bringing us to this much needed conversation. We did mention we have an extraordinary doctor with us here in studio. We are going to be talking things spine and brain surgeries and everything in between. But even before we get to that, Chico did ask, what's the one thing you would pivot from? Because this is a doctor we're having a conversation with, a surgeon, and then happens to mention that he has an artsy side. He's an artist, a photographer, well renowned actually. Has his accolades well in order, and I was so curious. It's like, man, you transition from being an artist and then boom, you're doing medicine.
Photographer to medicine. Dr. Mahindraa, that is quite the story. Why don't you tell us about your journey from there transitioning into neurosurgery and what actually inspired you?
Good morning, Nairobi, and good morning, Kenya. So the journey, in the school times, we had no fixed target. My father was a general practitioner, and he wanted me to be a general practitioner, and I didn't want to do that. So I was going haywire, and I was naturally a painter and a poet. So I used to go into literature and painting and nature, and all of those things used to happen. And I was not fixing into any particular thing, and a lot of fights between me and my father. Till I found an institution which was in those days very rare, like I'm talking of 1985, 86, 87, is that very few hospitals had this department of neurosurgery. And so when I went there and I saw this big plaque where it was written Department of Neurosurgery, I asked a doctor who was passing by, I said, what does it mean? He said, that means we operate brain and spine. And then I said, this is what I want to do. And the same week I went back home and started studying for medicine, and my father said, what the hell are you doing? You never study. So I said, this is what I want to be. And then that took me 15 years to become a neurosurgeon from the top medical institution of India, which now stands as number 2 in Asia and among top 10 in the world, so All India Institute of Medical Sciences. So it's quite a journey. And then I blended art with science, where I started doing illustrations for neurosurgery and neurosurgeons and big institutions, well published. And also, if you have a creative mind, then you can create new things, as we will discuss later, that we have kind of created new treatments, new surgeries. And I think the creativity everyone has, but then parents force us to choose one. And that's where I don't think it's the case. Everyone should have an artistic side, because, as we say, state of the art is when you go into an abstract from the science, because science is a very fixed, well-known standards. And in every Hollywood movie, you would see a scientist shown as a very abstract, ill-dressed, ill-mannered guy.
Yeah.
That's not my idea is all about. It's like, if you have an artist side, then you can put everything together in a more beautiful manner, including treatment.
I love that. It's how you blend in the quirks of being an artist to now things that are rooted in a lot of fact. And I wanted to put science and logic in the same sentence. Then I was like, no, Flaris, don't do that. But we are here with Dr. Mahendraa to discuss all things brain and spine surgery. And a lot of things are we could have this conversation for in a number of series, because it's not one of those things that I believe we can finish in one sit down, given that it's so complex. We are looking at the different components of, again, neurosurgery. And earlier on, I was asking Dr. what's the difference when you say a brain surgeon and a neurosurgeon? Are those two distinct disciplines, or are they one?
No. It's a very deliberate discretion that I have, put into my description. Is when you say brain and spine surgeon, because spine is a bone structure. So for a long time, and orthopedic is a much older science compared to the neurosciences, because neuroscience was so complex. It took time for people to put things together, how to operate. And initial neurosurgeons had 100% mortality when they were operating. And from there, we have come a very long way. And so when people associate you with brain, which is a very soft structure, and then to the bone structure, and so spine is encasing the neural structure, the tail of the brain, which is called spinal cord, and the nerves, the exiting 32 pair of nerves. So basically the problem is not coming from the bone, the problem is coming from the nerves impinging into the bones. And so many times people do not associate neurosurgeons with spine. And so when you say neurosurgeon, they think, okay, brain surgeries. But no, it's not. It's like they are the experts of repairing the nerves, decompressing the nerves, and obviously when you handle brain, you learn so much of sophistication into your work. You can dissect to the millimeter. So that's what gives us a precision. So that's why I say brain and spine surgeon, so that people know that they are my friends, and they wouldn't know that, I also do spine surgery. So they go somewhere else and they say, oh, you also do spine surgery? Then we say, yeah, neurosurgery is spine surgery integrated.
Yeah.
Yeah.
It's, again, back to, when we speak about spine, a lot of people get really scared in the event of an accident. For example, you find a lot of people, the fear always comes from, is my spine okay? Is it hurt? But then again, we've seen that accidents are not the only thing that you should be on the lookout for when it comes to the health of your spine. We're talking about ordinary living, like you working at your desk, for example, and how that ultimately would affect your spine health. Are we able to look at, maybe you could give us context to what encompasses spine health?
Yeah, spine health is more important, like, in contrast to India, because it's a much bigger country, so maybe the more population density, whatever. Here I see less accidents compared to India, because in India, every 1 second there is an accident happening. And obviously, one more thing is that I would give it to Kenyans. They've got much better traffic sense than Indians, believe me. There's so many Kenyans who say, oh, see, Kenyan traffic, I say, much better than India. So, traumas are different, but we talk of the daily degeneration because, we are born with a body which is going to, there's something called planned cellular death. We all are born with a code of dying. And everyone has a different code that we don't know. We are not able to read that. But that means that our disc will degenerate as the age passes by. Our, the whole of the tissue, the muscles, the ligaments, which is putting the spine together. So that's called the degenerative spine diseases and the degenerative disc diseases. So that is something which is on a daily basis. So that's one is the genetics, another is epigenetics. That what environment you are putting you through, what kind of posture you're acquiring every day, and that will determine how fast your spine can degenerate. Like compared to men, women will degenerate faster because they have to bear children, and during pregnancy the hormones are released which cause loosening of the ligaments and change dynamics on the spine, particularly in third trimester of pregnancy, when the disc can also rupture, particularly if one particular population is more prone to breaking of the discs, which is prevalent in Africa. So because of that, the degeneration will happen earlier. So I think we should have an awareness campaign where we talk with people that what are safe postures, which posture is going to protect you from early breaking of the disc, or like, immediate post-pregnancy, the females are bound to sit and feed their babies, and that also causes problems. So I think everyone thinks that they go to gym and the spine will get better, but that's a very wrong concept. I've been with gym trainers and they just want to go through the exercises, which is very wrong, because spine has got a particular curvature and that needs to be followed, that needs to be strengthened. And if you do that in a particular way, and there are just 3, 4, 5 exercises, if you do 15 minutes in a day, very at your pace, you're fine. So I think that awareness is not there in people, even in people associated with fitness.
We will come back to those exercises so you can walk us through some of them, because it will be key to educate us in terms of that. But there's a phrase now that we're talking about spines and surgery that I saw, daycare spine surgery. Delve into that one.
I'm the one who's pushing it.
So delve into that one and educate us on that, the difference between that and, the conventional.
So I want to change the narrative that, people think, and even doctors have put it this way for a very long time. In fact, there was a time last year, December, I was invited in a conference to speak as a faculty, and my flight got delayed, and then those 2 nights were very disturbing, and I had to present whatever cases I have done here, and minimally in endoscopic spine surgeries. And then I was thinking that now let's talk more on philosophies than the techniques, because everyone is talking about techniques, but it's more important to learn the philosophy. And I wanted to teach the surgeons that don't promise any patient that one surgery you're done for life. That is such a wrong narrative that was being presented. And because obviously surgery comes with a lot of fear, the loss of money, or you spend money to get the surgery done. And because of this narrative, that the problems happen against an expectation. The feuds happen against an expectation. If you set the expectations right, people will not fight with you, or people will not think this is a wrong surgery, because they must see what's coming in future. So I'll just give you an example for that, is that there are 5 lumbar bones, and in between those 5 bones there are 5 discs, and about 20 nerves are passing through. 20 nerves, which are, taking care of our anything under the belt. Okay, so control of your urine, control of your power, sensation, everything. And then there are 3 sides from where the disc can rupture and can encroach upon your nerves. And then each vertebra has got 4 joints. So now in 5 bones there are 20 joints. Patient comes to you with a, say, L4-5 disc, slip disc, and now you're treating that, and then you're never telling them that, something else can happen. But I tell them, this is a degenerating thing. It's like a car, which is, say, a patient comes to me 45 years of age, and I would say, you're a 45-year-old car. And don't think that if I repair something here, then the other will not tear apart, So it all depends upon what you're telling the patient. And so apart from that, understand one thing, we've got 32 teeth, right? And when we go to the dentist, we know that right now my upper molar is a problem, but tomorrow you can have a lower molar problem. So, and dentists give you sittings. And spine needs repair at multiple places. And now we are getting minimally invasive. We can go with a very tiny camera, say a 2.5 millimeter camera, we can go inside the spine when the patient is awake. And so we are talking to them, we are playing music in the operation theater, and we are operating, and patient is seeing their own spine on the big TV. Like I've got a 65-inch TV, and then one relative is sitting there, and then there is music and beautiful sight around. And so we are trying to take the fear away. Yeah. Once they've been told that this is what I'm been doing the maintenance. Yeah. Unless there is, if someone has got a spinal tumor, it's a different thing, you're curing. But when there's a degeneration, right now I am doing maybe L4, L5. Okay. And so when we have this long, complex discussions with patients, and then we say it's a maintenance, and then we are also working on regenerative spine therapies. Because now there's a lot of things happening, like women are going for PRP on the face, and for hair there is a PRP. There's also a PRP for the disc and the joint tissues. So why don't you imply all those things into spine health? Because just cutting and fixing, putting screws over there doesn't work, because spine was supposed to be mobile. And if you make it immobile, it creates another problem in next 1 or 2 years. Yeah. So that's how we do it. We do it tiny bits. We agree with the patient that maybe you will require 3 sittings in a year, but if the one sitting is pleasant with them, they become confident. So mostly patients come to me, I operate them at one particular disc, and they walk out of operation theater. And so there is no need, because we're not cutting the muscles. We're just going inside with just a 4 millimeter stick with a camera at the end. So that's what happens, and patients are pleasant. They go home the same day. And so now the experience changes. So it becomes a lifestyle surgery than a surgery which is feared for.
I never thought I'd hear the words lifestyle surgery and spine in the same sentence. But Dr. here is not only educating us, but also informing us on how you can properly take care of your spine and just make sure that as you're degenerating, you go in for maintenance, and there's all of these options available to you. We are going to get back to this conversation, because if there's one thing I'm very particularly looking forward to understanding is chronic headaches, which is something that we need to get into now that we're discussing the brain and all of that. Stick around. This is 984 in the morning with me, Falaris and Chico.
Capital Sports Update, where sports is taken seriously.
Well, if you're a Manchester United fan, then your headaches will be sorted out by Dr. Mahendraa in just a second. Just kidding. You need to change clubs. Newly crowned world champion of the women's marathon, Perez Jepchirchir, believes her injury ahead of this year's London Marathon in April was actually a blessing in disguise. Now, Jepchirchir says the injury, which forced her to drop out of the competition, made way and paved way for her victory at the ongoing World Championships in Tokyo.
I was so tired, I was so stressed, but I didn't lose hope. I came back with my shape. I was in a great shape preparing for London, but I rested for 2 months and I resumed my training. But before, I was having that feeling that I'm going to go to run one championship. I was to run to Berlin, but I decided no, let me go and run one championship. Yeah.
Now, the 31-year-old clocked 2 hours, 24 minutes and 43 seconds, beating Olympic silver medalist Sefa to the finish line. Meanwhile, triple world champion Faith Kipyegon is rather optimistic of a podium sweep for Kenya in the women's 1500 meters at the ongoing competitions, the World Championships in Tokyo. Kipyegon says the three of them, including Nelly Chepchirchir and Dorcas Ewoi, are in peak shape and are determined to make history come tomorrow.
You know, that's what our biggest goal, that we make it to the final, the four of us. But unfortunately, Susan didn't make it. But the three of us who have make it, we hope for the best. We hope this time around we are going to do top 3 in the finals coming on Tuesday.
Now, on the international scene, the world of boxing is mourning after British legend Ricky Hatton was found dead in his house yesterday, apparently from suicide. A statement from the Greater Manchester Police indicated that the officers were called to Bowlacre Road in Manchester, where they found the body of the 46-year-old former boxer known as the Hitman. He was 45 out of 48 professional bouts across his 15-year career, one of them notably that one, which I always remember, the face-off against Floyd Mayweather. Rest in peace to that former boxer.
Capital Sports Update. Up to the minute sports, where sports is taken seriously. Coffee's on, and so is the music. You've found your morning show. Capital in the Morning with Chico and Falaris.
From the moment I saw you, I went out of my mind. Though I never believed in love at first sight. But you got a magic, boy, that I just can't explain. Well, you got a way that you're making me feel I can do anything for you, baby. I'll be done for you, baby. Any of my cards out tonight. Just call on me, baby. I'll be there in a hurry. It's your move, oh, baby. Baby, please do whatever you want from me. Giving you everything. I'm your baby tonight. You're giving me ecstasy. You are my fantasy. I'm your baby tonight. From the second you touched me, I was ready to die. I've never been fatal, you're the first time. I feel like an angel who just started to fly. Well, you got a way that you're making me feel I can do anything for you, baby. I will fly for you, baby. Hold on and enjoy the ride. I'm not in no hurry. We can fly all night, baby. It's your move now, baby. Baby, let's fly. Whatever you want from me.
Whitney Houston playing right here on Capital in the Morning with Phalaris and myself, Chico. We're talking to Dr. Mahendraa, and we're talking brain and spine surgery with a focus on headaches, which is what we get to every time we have to stop the music, because music does something to the soul. Which brings me back to the Daktari, the good doctor, who actually talked about some of the things, the experiences when you go in to his practice, and one of them is, he was telling us just now off mic, and I'll share it with you, is the windows and what you see and what you experience during the surgery. Music being absolutely key, very few machines. Doc, it's interesting you should say that, because I think there's a psychological aspect to it. I was telling you how I need some to check out my spine, but I won't go in simply because it kind of scares me, the intrusive slicing open going through. So it's good you have that minimal intrusive procedure, but at the same time, how important is it from your experience for patients to feel as calm as possible, and what do you do to make this whole experience easier?
Yeah, so that's what I was saying, that you can't lifestyleize something if it is not pleasant. Like women go for, the nail things and the hair, and sometimes my wife goes, and it's 6 hours they are inside the beauty parlor.
Yeah, we
and
need to
when
check
they come
their
out,
brains.
but so they also take pains during that time also. But that for them, they know, because it's a lifestyle, it's going to make them better. And so they take all the pains, like drilling of the nails or whatever they go through. So we don't have the luxury to do that.
No, we eat them.
So I was just thinking, and that's where the creative thinking comes, that how can you give them a pleasant experience? Yeah, every doctor, it is taught that you should be warm with the patient and things like that. But few things, if you allow one of the relative who is the closest to you. So I ask patients, who are you closest to? If you are closest to, then you would find a heartwarming comfort, and then you are able to say, because sometimes they are so intimidated with the presence of a doctor, the machines and things like that. And so we keep one relative very close to the patient, like he or she is holding hand of the patient, and those kind of things happen. Second thing is putting in the music, and then the visuals, because visuals also matter. And in visuals, I break them into few things. Like one is, people will get intimidated to the machines kept in the operation theater. So of course we need something, but like most dreaded ones are the ventilator or anesthesia machines. But we are doing most of the surgeries, like 99.9%, under local anesthesia, meaning the patient is awake. So they have to be kept warm. They should see beautiful things. So like we have an interior which looks like as if you are inside a Venetian palace and you're seeing a lake and mountains outside. So, and then having music, and then talking cordially, and having a lot of fun during surgery. So all of that matters, and that's what will bring them for the next stage, because as I said, we are doing maintenance surgeries, we are not curing. So many times we are doing regeneration, sometimes we are removing an offending agent, compressing a nerve, sometimes we are just doing a pain management. So it's a mixture of all these things, and you have to break this into multiple steps. So you come up with a system which we are putting through patenting process, so that it becomes a standardized thing for future. So that's what I inspire people, that the hospital should not be intimidating. They should be pleasant to you, and we have to be on the patient side to think about all of these things.
You were talking about degeneration, and I know Phalaris had just teased about the headaches, which we'll go into, but just going back to this Daycare spine surgery, still a new concept, which now that you've brought a bit of understanding, what procedures are actually done, and what's the recovery like, the recovery period? So
as I said, that we whenever a patient comes, and we normally have a discussion of around 45 minutes to 1 hour with one patient. So I'm very slow in that regard, and in that time I'm talking about the family, the village, the clans, because I'm still new to Africa. This is my 5th year, and then you keep knowing people more and more, and there are different cultural beliefs and family structure, or like we have got a lot of patients coming in from neighboring countries, but as far as from USA. So we first talk about those things. Then I explain that this is my concept. This is what I'm telling to the surgeons. This is the same thing I'm telling to you. Multiple stages. Things keep coming back. Don't blame me. But this is how it happens. And then we split them. Like there are so many components around the nerves. There is joints which are compressing the nerves. There is a disc which is suddenly encroaching. Right? There is a wrong posturing. So sometimes there's a muscle pain. So you have to understand all the pain theories. And there are so many pain theories that even doctors don't understand. Like the one is a Melzek's theory of pain, which says that pain doesn't have any center in the brain. And it's all a very composite of patient's emotional status, their social status, and their body status. Like someone is alone, okay, and now they have maybe a slight disc pain, and then they went to a doctor and they said that, oh, you got a disc problem and you need a surgery, which may just require a PRP injection rather than a full surgery. So now she's thinking that she's alone, how she's gonna do this money thing, or even if that is not there, she's more perceptible to pains. So particularly daytime they may be working, but evening times they start feeling more pain, in the night times more pain. So, and then compare this lady with another one where there are like 10 family members, and they said, you don't worry, we are going to take care of you. And that's when the pain structure in these two people will be different. So all these things you have to understand, right? And if, like there are parents who are left here, they are like 75, 80, 85. I've even operated 87-year-old as an oldest, and the children have abandoned them. They live abroad, but now, you know, they are so vulnerable. And then being much junior to them, I try to give them a comfort that don't worry, we are there for you. And as I always say that I am a person who would always like to operate in front of a family member. That's the testimony of your competence and your confidence. And for me also, in the world of medical legal, you are more aware what you're doing, not being defensive, but at the same time, you think the best for the patient at the same time.
Yeah.
And even one of the most prominent spine surgeon or orthopedic surgeon's wife I have operated, my first condition to him was that you have to be inside the operation theater, otherwise I'm not operating her. So it was a 7-hour surgery, but he was sitting there and I was operating.
There's many ways in which you're contrasting yourself to the usual experiences that we have. Family members there, make sure that there's music, make the patient comfortable, get to know the patients and learn at the same time, which then brings me to a page that I'll put my finger in, but we'll come back to that. You've talked about an 87-year-old who lives abroad, the children have abandoned her, coming in, operation. You've talked about people flying in from around the continent, and seeing as Capital is dealing with tourism, there's a medical tourism angle we'll come to in just a bit, but right now we have a headache to deal with.
You know, headaches, I struggle with them. I know often that, you know, we are always popping painkillers because for one reason or another you're looking to manage the pain. But chronic headaches are something that are affecting not hundreds of people but millions of people, and of course that has to have some reasons why this is very persistent. What are some of the common causes we are looking at, and what have you come across in your practice?
Headache had been a very, very emotional subject for me because my mother, who now is, she's not in this world, she passed away at the age of 48, but I saw her practically every week, at least one day, she would tie some cloth on her head and eyes, and she's so knocked down by the headache and there's nothing that we can do. And so I never knew what can be done, despite my father being a doctor for me. And we were not able to do anything. And then I realized headache is a big thing. And then I saw so many people. And as neurosurgeons, we neglect headaches because for us, there are bigger things. You know, there are aneurysms and there are brain tumors and those kind of things. So, but I was always passionate about headache, but I was going through the usual theories of migraine. And whenever you have a headache, you search the internet, you find, oh, I've got a migraine.
Yeah.
And for me, I totally dumped the theory of migraine because there's nothing like that. As this is me. Last time I had a interview with another radio, and it's on YouTube. So someone wrote that this doctor is, having a mischief, that he's saying that there is a migraine and there is a neuralgia, and then he's confusing. And I said, no, it's not confusion. So under that comment, I told my patients who I have cured more than 850 chronic headaches in last 4 years. And that's a big number. Because these are the patients who wanted to commit suicide out of headache. These are the patients who had lost jobs, husbands or wives, or families, or they've sold their property and gone across the world for headache only. So on paper, people say that this is the third largest neurological disease, the first being stroke and epilepsy. But I say headache is the most common neurological disease for which there is so-called no cure. But we are practically coming with a cure with a guarantee of about 99%. And that too within a day. So it goes to a story where a patient came to me and he said that for 4 years I have been going across the world, and he was a big man, that I have got this headache, and why don't you cut a nerve? There must be a nerve, and pain is mediated by a nerve, so why don't you cut it? I say, yes, I cut the nerve, but I never cut it. But let's think about it, and then we operate trigeminal neuralgias. And trigeminal is a big sensory nerve for the whole of the face and the front part of the head. This is the largest sensory nerve from the brain. And so at that moment, I thought that if there is a blood vessel, which is a natural thing, so when we are growing from fetus to an adult, whenever a new tissue is created, it has got three components: artery, vein, and nerve. So that means that the artery, which is a high flow blood vessel, is always accompanying a nerve. And then gradually there is a conflict happening between nerve and the artery. So if that is happening inside the brain, why can't it happen outside? And then it can cause this. So we searched the internet, and then we found that yes, there are neuralgias. So we cut the nerve. Patient got completely pain-free. And that's 5 years now. And that led me to more and more researches. And then we also came out with, other than surgery, so I do migraine surgeries now. I have done about 6. Which means that, the number of migraine surgeries required is very less. But now we have come up with an entirely different system. I have created the grading of pain of headache, which has never existed in the world. And then everything that you say, you go to a page of migraine on any website. They will say there are patterns and this and that. I can explain everything from the point of view of a neuralgia. So what is a neuralgia? Irritation of a nerve which is causing severe pain. And then there is one particular nerve which is going to create pain all across the head. And so you have to identify this. So there is a system that we have created, how to identify that. And that whole process that we are following, that soon will come to the world in the name of research, because people love researchers. So that's how now we are curing headaches. Now I've got patients coming all the way from Boston. Boston is important because there is something called Mass General Hospital, from where the modern neurosurgery started. So from there, people coming to us saying that 1 year we have been there, no benefit, in just in 1 day I cured. Now recently I had a patient from Dallas. So though basically the patient is from Zimbabwe, but they live in Dallas. So whole family has headache. So headaches can be familial. So we also found out there are genetic reasons and there are developmental reasons. And there are acquired reasons as well. So I've come up with something called scar headache, which can happen after surgery or after trauma, and how to treat that. And these are the treatments that I first applied to my own family members. Like my wife had a migraine for 35 years, and I cured her. My sister's daughter, she had a scar headache, I cured her. So that's how we have now come up with things where we are saying, so we are also we are trying to encourage the medical tourism towards Kenya. When as an Indian, I know there's a lot of medical tourism going to India.
Yes.
But then, the worst part in that kind of tourism is that people can go once, but they can't go repeatedly, and follow up with doctors is very important. And for this one particularly, for my headache system of treatment, I am invited in the most premier institution of India to teach how I am treating them. So this is something that I think in the history in next 20 years, people will say the cure of headache was born in Kenya, and I'm surprised.